Welcome to the Deep Dive. We're here to cut through the noise and give you genuinely actionable knowledge. If you're getting ready for a new baby, or maybe you're just, overwhelmed by all the baby lotions and wipes out there, this look at our source material is definitely for you. Today, we're diving deep into essential baby skincare. It can seem baffling. Our goal, simple. Give you the insights you need to feel confident protecting that super delicate newborn skin.
And it really is more than just picking a nice soap. Baby skincare is fundamentally about safeguarding a biological shield. We need to understand the right techniques, the right products, hypoallergenic, non-toxic, basically how to protect very sensitive skin from irritants, from losing moisture, from everything external.
Okay, so skin is a shield. But why is the newborn shield so much, weaker than in adults? What makes it such a unique challenge?
It really comes down to the basic biology. Baby skin is roughly 30% thinner than adult skin. And crucially, that outermost layer, the stratum corneum, it's just not fully mature yet. That's the layer that's supposed to keep moisture in and keep things like pollutants, bacteria, allergens out. Because it's thinner and, frankly, less effective right at birth, it's constantly losing moisture. Plus, it absorbs pretty much anything it contacts much faster. So if you don't maintain that skin barrier properly, you're basically opening the door to really common and often distressing issues like diaper rash, like eczema.
Right, okay. Let's unpack that, starting with the basics of care. And maybe the most counterintuitive advice first. Resisting that urge to bathe the baby constantly. What did the sources actually recommend for how often?
Yeah, the guidance is pretty clear on this. For the first year, babies really only need about 2 to 3 full baths a week.
Hold on, 2 to 3 a week? Seriously, but what if my baby has a huge blowout or spits up everywhere? Daily reality, right? How does that fit in? Does a quick rinse under the tap count?
That's a really important distinction. We're talking about full immersion baths. The reasoning is pretty solid. Daily soaking actually strips away the skin's natural oils. And those oils, that natural lubrication, are absolutely vital for hydration, for keeping that fragile barrier we just talked about functioning. Too much bathing or using soaps that are too harsh, it messes with the skin's natural pH balance, the microbiome too.
Okay, so on those days without a full bath, we're not just ignoring the mess. It's more like targeted cleaning.
Exactly. You switch to spot cleaning. Use a soft, damp cloth. Focus on those areas that get dirty or have creases, face, neck folds, hands, and obviously the diaper area. And when you do give a full bath, keep the water lukewarm, definitely not hot, and use a very gentle, scent-free baby soap. And really, use it sparingly.
And the post-bath routine sounds like it's just as critical as the bath itself. What's the big mistake parents make right after taking the baby out?
Rubbing. Definitely rubbing. You absolutely have to pat the skin gently dry with a soft towel, no rubbing, no friction. Then you're kind of on the clock. Immediately, ideally within like 3 minutes of getting them out, apply a baby-safe moisturizer. That seals in the moisture from the bath before it just evaporates away.
Which brings us right to lotions, the big question. Can you even put lotion on a tiny 2-week-old? Is it actually needed if they look a bit flaky or peely early on?
Yes, you absolutely can. But the sources really stress using it sparingly and only when needed. Newborn skin often does flake or peel a bit as it adjusts to the air. So a thin layer of moisturizer can help prevent excessive dryness or cracking. But the key advice is, it must be hypoallergenic, truly fragrance-free. The caution is really against using thick lotions too much or reapplying constantly because that can actually block pores, especially in those little creases like armpits or the neck.
Okay. Let's move to probably the most vulnerable area for irritation, the diaper zone. What's the step-by-step for cleaning and protecting there?
Right, diaper care demands. Well, relentless frequency and really good technique. Change those diapers, often think every 2 to 3 hours or the second you know it's soiled. And when wiping, always remember the golden rule, front to back, especially for baby girls, to stop bacteria spreading forward. Once clean, pat the area completely dry. Don't leave it damp. Then apply a thick barrier cream or ointment.
What should we be looking for in that cream? What makes it a barrier?
You want active ingredients like zinc oxide or petroleum jelly. Zinc oxide is sort of the classic for a reason. It creates an actual physical waterproof barrier on the skin. It ensures wetness and acids from urine and stool don't even touch the skin underneath. That layer is really your best defense against diaper rash.
Now, this is where things get really interesting, I think. Moving beyond just cleaning into environmental physical protection. Thinking about, the sun, their clothes, even stopping them from scratching themselves. Let's start with sun. I remember looking at baby sunscreen and seeing all these warnings about age. Why does sun protection advice change so drastically at 6 months?
Yeah, that 6-month mark is super important. Infants younger than that have less melanin, yes, but also a much higher risk of absorbing things systemically. Their skin barrier is just so immature, it can absorb the chemical ingredients in many sunscreens way too easily, so the advice is pretty strict. For babies under 6 months, avoid chemical sunscreens completely.
Okay, so if we have to be outside with a little one, what are the safe ways to protect them?
Shade is always your first line of defense. Stay inside during peak UV hours, usually 10 a.m. to 4 p.m. If you must be out, you have to rely purely on physical barriers. Wide-brim hats, light-colored clothing with long sleeves, dense stroller canopies. Then, for babies over 6 months, you can introduce a baby-safe mineral sunscreen. Look for zinc oxide or titanium dioxide with an SPF of 30 or higher. Apply it to any exposed skin and remember to reapply it every couple of hours.
And something we might not think about as an irritant is just friction from their clothes or even the detergent we use. Laundry seems so simple, but it's a big trigger, isn't it?
Oh, absolutely. Regular detergents are made to be pretty aggressive cleaners. They have enzymes, strong fragrances. They leave residues behind. And those residues are major irritants for infant skin, causing contact dermatitis. So you really have to wash everything that touches their skin coat. Bedding, towels, blankets, with a gentle, fragrance-free detergent that's specifically marked safe for sensitive baby skin.
And what about managing heat? Preventing heat rash?
Heat rash or prickly heat happens when those little immature sweat glands get blocked. Often it's actually because parents overdress the baby, trying to keep them warm. The key is ventilation. Dress them in loose-fitting, lightweight, breathable cotton. Definitely avoid synthetics that just trap heat. And also, maybe hold back on very thick, heavy creams in hot weather, as those could potentially clog the sweat glands too.
Okay, and one last small detail, but one that personally caused me a lot of stress. Nail care. Clipping those tiny nails felt terrifying. Any tips from the sources on making that less stressful?
You are definitely not alone. It's a common source of anxiety, but it is necessary. Infants just don't have control over their hands yet. Long, sharp nails mean accidental scratches face, eyes risking irritation or even infection. Fingernails grow surprisingly fast, needing a trim every 1 to 2 weeks. Toenails maybe every 2 to 3 weeks. The best tip to reduce the stress is timing. Use baby clippers or safety scissors with rounded ends and do it when the baby is super relaxed, maybe right after feeding or the ideal time, when they're sound asleep.
All right, now for those aha moments. How do we actually manage common skin issues when they inevitably pop up? Because even with the best care, things like eczema, cradle cap, baby acne are incredibly common.
Yeah, let's tackle these by focusing on the core management strategy for each one, rather than just a long list of things to try.
Perfect. Let's start with eczema, or atopic dermatitis. Those red, dry, really itchy patches.
Eczema, fundamentally, is a battle against dryness. So the absolute cornerstone of management is frequent moisturizing. And not just any lotion, we're talking thick, medical-grade, fragrance-free emollients. Think of them as heavy-duty moisturizers that really sit on the skin and create a protective, lipid-rich shield. Alongside that, keep baths short, 5, maybe 10 minutes max, and only use lukewarm water. Then immediately after, apply that thick emollient generously.
Okay. And what about cradle cap? Those greasy kind of yellowish scales, usually on the scalp. It can look pretty alarming.
Cradle cap, seborrheic dermatitis is super common. Up to 70% of babies under 3 months get it. It looks worse than it is usually. Treatment is all about gentle removal. You can soften the scales first, apply a baby-friendly oil, mineral oil, maybe coconut oil, let it sit for 10 or 15 minutes before bath time. Then, during the bath, use a gentle baby shampoo and softly brush the scalp with a soft brush or washcloth to lift the loosened scales. Rinse really well. The key is not to pick or scrape forcefully, as that can damage the skin underneath.
And lastly, baby acne.
Baby acne, the little red or white bumps, usually on the cheeks or forehead, almost always caused by leftover maternal hormones sorting themselves out in the baby's system. It's totally harmless and typically fades on its own in a few weeks or maybe months. Treatment couldn't be simpler. Gentle cleansing with just plain lukewarm water. The really crucial warning here, do not use adult acne treatments. Things with salicylic acid or benzoyl peroxide or any medicated creams will be far too harsh and will badly irritate infant skin.
Which brings us full circle back to product choice in general. You've mentioned fragrance-free and hypoallergenic a lot, but let's get specific. What ingredients should parents actively look for, and what are the big chemical no-nos they need to avoid, and why?
Okay, so you always want products labeled hypoallergenic, dermatologist tested, and truly fragrance-free. Look for natural, soothing ingredients known to support the skin barrier. Things like aloe vera, shea butter, calendula can be great. Now, on the avoid list, really scrutinize those labels. Steer clear of alcohol, which is incredibly drying. Avoid sulfates. They make things foamy, but they strip the skin's natural oils terribly. Also parabens. They're common preservatives, but they're linked to potential irritation and allergic reactions in sensitive individuals. And definitely avoid artificial dyes. They add zero benefit, just unnecessary chemical exposure.
And even with a product that looks perfect on paper, there's one final safety step you should always take, right?
Absolutely. Always do the patch test. Before you slather a new lotion, sunscreen, or even use a new detergent on all their clothes, apply just a tiny amount, put it on the baby's wrist or maybe behind the ear, and wait 24 hours. Watch that spot closely. This checks for any redness, rash, or irritation before you use the product more widely.
We have definitely covered a lot of ground. From that key, less is more approach to bathing, all the way to creating physical shields against sun and friction. I think the core message filtering through all this is consistency, plus really mindful, ingredient-aware product choices are absolutely crucial for supporting that incredibly fragile newborn skin barrier.
Exactly. And just before we wrap up, we've focused mostly on ongoing routines, but
Yeah.
there's one very specific time-limited care task right in the first few weeks we shouldn't forget, the umbilical cord stump.
Ah, yes, the cord stump. What's the special advice there until it falls off?
Until that stump dries up and falls off naturally, usually takes 1 to 2 weeks. The absolute priority is keeping it clean and critically dry. This prevents infection. So that means sponge baths only initially, no full immersion in water, and very importantly, make sure the top of the diaper is folded down, tucked well below the stump. You want air circulating around it constantly to help it dry out, and you don't want the diaper rubbing against it or trapping moisture there.
That proactive, almost preventative mindset seems to run through everything we've discussed.
It really has to be the foundation because that newborn skin barrier is just so delicate, so prone to inflammation. Early management is absolutely essential. Tackling even minor skin irritations quickly, through good hydration, protecting from irritants, UV protection, that's the best way to stop common things like eczema or diaper rash from getting worse. It really lays the groundwork for healthier skin long term.
So knowing now just how easily baby skin absorbs chemicals because its barrier is so thin, here's something to maybe think about. How might those seemingly harmless things in our homes, air fresheners, scented candles, even strong cleaning sprays, how might they be impacting an infant's developing skin, maybe even their respiratory health, while that protective shield is still forming? Definitely something to consider as you look around your own home environment.